there. Today we're going to work on 90-90 breathing, and this is a great exercise to do to learn how to breathe. A lot of you are already doing some diaphragmatic breathing, but this dials it in a little bit more, and it's really great for those of you that are dealing with some sort of low back pain. Okay, so what I would like you to do is, if you have a yoga ball like this, that would be great. If you don't, then you can use a chair or a couch, as long as your legs are at a 90 degree. So it's going to look like this with the setup. So what I want to do is, I want to have my feet, the ball would typically kind of be here and will be just really relaxed. But what I want to do is, I want to put the heels only on the ball or the couch or the chair, okay? And that way I can challenge myself a little bit, but also be in a safe position. But this angle is really, really important, this here versus this here, okay? So just heels on the surface like that, and you don't want your legs too open, just keep them, at a regular position. Okay, so now what we're going to practice is, we don't want to be arching our back. Typically that's what people will do. So the cues I want you to pay attention to in this posture are, I want your neck long, but your chin tucked a little bit. So we don't want to be reaching back or too squished. We just want to have a nice long neck, and our chin is just down a little bit. Our chest is wide and open, so our shoulders can drop back and relax. And then a lot of times we have a tendency to have a rib flare here. So what I want you to think about here is bringing the ribs down. And when we bring the ribs down, you automatically feel that low back sort of just like cradle into the floor, right? So we're not arching anymore with a rib flare. We're pulling those ribs down to the pelvis. So we're creating that nice low back position. Okay, so cues: neck long, chin tucked slightly, chest open, ribs down. And now what I want you to do is, I want you to place your tongue behind your front teeth, okay? So as you're doing that, you'll notice that your airway will open a little bit more and your jaw relaxes. So we're going to take a deep breath in with our tongue in that position, and you're going to fill your belly, okay? So tongue is on the back of the teeth, cradling the palate at the top of the mouth. Deep breath in, okay? And on the exhale, what I want you to do is keep your tongue there and just shush the air out. So I'm going to do it. So I'm going to breathe in. So I'm making a shushing sound. So when I do that, you may notice that my inhale is shorter than my exhale, and that's what I'm looking for. So when we're exhaling, we're really, really pulling the abdomen in and letting that low back relax, okay? So it's relaxing, but it's also creating stability. So I'm going to do it again. So all of my cues: neck long, chin tucked, chest wide, ribs down, breathing in through the nose. And as I get to the end, I can feel my abdomen contracting. So when our abs are strong, and we have that, we create that intra-abdominal pressure, it takes the load off of that low back. So give these a try, this 90-90 exercise, this breathing technique.
and I think it will help you create more low back stability. Okay, so we're gonna incorporate this into your correctives and see how it goes. And it's really relaxing and comfortable, and it will integrate into other things that you're doing. Okay, thanks so much.